Uterine fibroids are benign. They're very common. Almost 40% of women will have fibroids from the age of 30 to 50. However, not all of them need treatment. They're many times asymptomatic. Now, if there are symptoms, they can be debilitating. Most of the time, heavy menstrual periods, prolonged menstrual periods, frequent urination, pain, and heaviness. Those patients that need to be treated nowadays can avoid going to surgery. Hysterectomy, unfortunately, is still a common procedure for these women. Hysterectomy is a radical procedure to take the uterus out. Nowadays, we can do a minimally invasive, image-guided procedure, which is called uterine fibroembolization, to treat women with symptomatic fibroids. What we do is go through the artery with a little catheter, the artery that goes into the uterus, the artery that feeds the fibroids. We inject tiny little particles, essentially to block the blood flow to the fibroids. They will shrink, and of course, the bleeding will stop. Patients will keep the uterus. The menstrual periods will be normal, 3 to 5 days, significantly less heavy, and with less symptoms. Less pain, minimal bleeding, essentially normal periods. If you're facing surgery for fibroids, I will suggest to get a second opinion. A uterine fibroembolization will avoid surgery in most of the patients. There's no need nowadays to have the uterus removed. Of course, there are patients that will need a hysterectomy, but many will not. It's unfortunate that 40% of women that will go to the operating room for a hysterectomy do not know about this minimally invasive procedure, which is called uterine fibroembolization. It's a very simple procedure. It's done outpatient. It's not painful. There are no scars. We don't open the abdomen. We do it through the arteries. We go into the uterus, through the uterine artery, and we will stop the blood flow to the fibroids, and they will shrink and they will stop bleeding.